In a wide-ranging news conference, Press Secretary Sean Spicer pushing hard for the president's hopes that Congress will tackle both the revised health care plan and the 2017 budget bill, take a vote on both, and move the country forward by Friday. Now, regarding health care, Spicer said, quote, Obamacare is dying on the vine. But that question mark hanging over whether people with pre-existing conditions can count on being covered without paying a fortune, Spicer said, quote, we're not getting rid of it, we're strengthening it. Let me bring in Republican Congressman Lee Zeldin of New York. You were listening all along, and with the rest of our viewers, what did you interpret from that?
They are trying to get to 216 votes to pass this bill in the House as early as tomorrow. As what has been said by many is that as soon as the votes are there, that a vote is going to get scheduled. The Vice President is here in the Capitol. Leadership talking to members who may be on the fence, and there's a concern that has existed, going back to this debate during last year's campaign, is ensuring that we are doing everything in our power to address the commitment to repeal and replace Obamacare and to also take care of those individuals with pre-existing conditions. So we have to be smart about our policy and be as effective as possible, and that's why so many people who care so deeply about this issue are working so hard on it.
Let me get this news to you. Just minutes ago, Congressman, Freedom Caucus Chairman Mark Meadows said the amendment offered by Republican Representative Fred Upton and Republican Billy Long, proposing, about $8 billion over 5 years to help people with pre-existing medical conditions afford coverage, that they are supporting that. Is this a game changer for the vote, and could we see the vote by tomorrow?
It's a possibility, as what was said over and over again, was that as soon as the votes are there, that the vote on the bill is going to get scheduled on the House floor. The Freedom Caucus, which, as they were doing their interviews with you and others just a few weeks ago, they were opposed to the bill in its form as of then.
True.
They were negotiating in good faith to try to bring down premiums and deductibles and represent their home districts and states. And then you have people in the Tuesday group, more moderate members, who were undecided or leaning against the bill, articulating that they wanted to...
Where do you stand, Congressman? Because obviously you are a Republican in a blue state of New York, and there are many people who are not convinced that those with pre-existing conditions will be covered, because it will leave it up to the states to decide whether they want to cover that. And if not, then you've got an $8 billion kitty to put together here. But is that enough? And it's not as if people with pre-existing conditions are always rolling in the dough. They probably spend a lot of money in some cases on their pre-existing health problems.
Well, first off, there's the principle that if you can't afford your coverage, you don't really have access to it. I happen to be, being from New York State, which is a blue state, also has a long history going back way before the ACA with regards to essential health benefits, community rating, covering people with pre-existing condition. The laws, the rules have been around for a long time. While you create a system for a waiver from those with regards to the MacArthur Amendment, I don't anticipate New York State's governor and state legislature to be requesting waivers from those aspects, but what I do expect is that from other states, you'll see that waiver request being made because they want to have additional options. But New York, I don't believe at all that that waiver request is going to be coming.
Okay. To repeat, though, you said we could see a vote on this health care bill by tomorrow. Is that a possibility, just to be clear?
I believe that as soon as the votes are there, that there would be a move to go to the House floor and to pass this bill as soon as possible.
Congressman Lee Zeldin of New York, thank you so much for getting in front of the cameras as all of this is developing.